Welcome, everyone, and thank you for joining us today. Yesterday, the United States reached two significant milestones in the coronavirus pandemic. As the first doses of the vaccine were delivered, the COVID-19 death toll reached an ominous new high: 300,000 lives lost, including at least 1,600 incarcerated Americans. Into this moment, the National Commission on COVID-19 and Criminal Justice released its final report, outlining a priority agenda for a post-COVID-19 justice system. This builds upon their interim report, detailing the immediate steps system leaders must take and continue to take to control the spread of the virus within prisons, jails, and courts. I'm Abby Walsh, Vice President here at the Council on Criminal Justice and manager of the Commission, along with my colleague, Commission Director Thomas Apt. Since the Council's launch, we've convened expert task forces to support our members in the field in general as they navigate challenges, both emerging and longstanding in criminal justice. Today, we will hear from commissioners and council members on this important endeavor. Dr. Tom Inglesby is the director of the Center for Health Security at Johns Hopkins School of Public Health and an internationally recognized expert on public health preparedness and infectious disease. Pastor Michael McBride is the director of the Live Free campaign and a national leader in the movement to implement public health and community-centered gun violence prevention programs. Melissa Nelson is the state attorney for Florida's 4th Judicial Circuit, where she leads an office of over 300 attorneys and has implemented smart justice initiatives, including Florida's Conviction Integrity Review Unit. Herman Lopez, senior correspondent at Vox, will moderate today's discussion. Before we begin our program, a few notes. We are joined by nearly 300 participants today, including policymakers, the public, and the media. To ensure a quality experience for everyone, all lines are muted, but we want to hear from you. So throughout today's session, you can submit questions using the Q&A box at the bottom of your screen. We will take as many questions as possible at the end of today's session. Now, let's welcome Commission Director and Council Senior Fellow, Thomas Apt. Thomas, to you.
Thank you, Abby. It's a pleasure to be here today with all of you who are watching remotely. I'm going to talk to you a little bit about and give you a brief overview of the recommendations of the Commission that were released yesterday so that we can jump right into a discussion with our panelists. First, let's discuss the mission of the National Commission on COVID-19 and Criminal Justice. The mission is threefold. First, to assess the impact of COVID-19 on the criminal justice system. Second, to develop priority prevention strategies to minimize the impact of a resurgence or future pandemics, simply to stop the spread of COVID-19 immediately. And finally, to establish a priority agenda for a post-pandemic criminal justice system. The Commission members represent a wide spectrum of those of stakeholders in the criminal justice and public health fields. We have representatives from policing, such as Charlie Beck and Chief Adrian Diaz, representatives from the judiciary, from the courts, such as today's State Attorney Nelson, the Honorable Alberto Gonzalez, and Justice Tina Nadeau. We have community advocates and activists, such as Pastor Michael McBride, who is with us today. We have academics, such as Dr. Stephen Raphael, and of course, public health experts like our own Tom Inglesby from Johns Hopkins, who is with us here today. The Commission, given the spread, the quick spread of the virus, had to work quickly. We were established in July of this year, and we immediately started releasing reports on crime trends, jail case rates and deaths, prison case rates and deaths, substance use disorders, racial disparities in the COVID-19 response, and of course, public health and the prison population. As these reports have been released and then also updated as we go, we've also released our interim recommendations, which came out on October 1st. And these detailed 33 concrete steps for leaders to take in the criminal justice field to stop the spread of COVID-19 right now. Those recommendations remain relevant, and I urge those of you on the call to review those. And then finally, released yesterday were our final recommendations. These are forward-looking recommendations to really envision a new criminal justice system that better balances public safety and public health in a post-pandemic world. I'm going to go over a few of the key recommendations here. There are 5 central recommendations and then supported by sub-recommendations. One of the things the Commission found, and this shouldn't be surprising, was across the criminal justice system, there was a widespread lack of preparedness for a public health emergency of the size and scope of the coronavirus pandemic. Every criminal justice agency engages in some form of emergency planning, but that emergency planning didn't really contemplate something like COVID-19. So a key recommendation of the Commission members was to build preparedness by engaging all sectors of the system, especially public health authorities and community-based organizations, in developing integrated crisis response plans. And these plans should be more than words on a page. They should involve active training, tabletop exercises, simulations, and other things to make sure that people are ready for, unfortunately, when the next pandemic may occur. In addition, we need to prioritize those who are incarcerated and working within the system for early access to vaccines and personal protective equipment. The Commission has recommended that those who are incarcerated in the nation's jails and prisons be categorized as priority 1B, along with all criminal justice staff who are working in direct contact with the public. And that's not just corrections, but also policing, courts, and those in the community-based organizations. In addition, the Commission recommended standing coordinating panels for public health emergency planning and crucially, building up community-based capacities to support justice-involved populations. For perhaps the first time, the Commission recognized community-based organizations as a co-equal branch of the criminal justice system. So, and sort of looked at all 4 sectors of the system, from policing to courts to corrections and community-based organizations, to see how they could better respond to public health emergencies. And one key point is that by building up community-based support, we believe that we can add much needed capacity and flexibility in responding to the next public health pandemic. Our second recommendation was to rebalance criminal justice and public health responses in order to limit contact, maximize distance, and reduce density. There were a variety of sub-recommendations that the Commission came up with in order to effectuate this recommendation, such as expanding emergency release mechanisms to permit the medically vulnerable to petition for release, investing in evidence-based public health alternatives to traditional law enforcement, particularly for behavioral health issues such as mental health or drug addiction, ensuring adequate access to behavioral health treatment, adequate medical care, and stable housing for those returning from incarceration. In addition, the Commission found, one of the major findings the Commission found was a wide diversity in the responses of criminal justice agencies. We found that some criminal justice agencies acted early, developed their responses based on facts and science, and stayed vigilant, while other agencies did not. And in facing this wide diversity, the Commission encourages the adoption of shared standards and best practices for responding to public health emergencies like the coronavirus pandemic. And the Commission believes that the federal government should play a central role in both identifying those shared standards and best practices, and then encouraging the adoption of them through things like training, technical assistance, and funding. In addition, another central challenge that the Commission found for the criminal justice system in responding effectively to COVID-19 was the lack of standardized aggregated public health data. Some prisons quickly reported public health information concerning COVID-19. Others did not. The same is true of jails, courts, police departments, and others. And so it's very important moving forward to collect and report standardized aggregated public health data concerning both justice-involved populations and their staff, and to increase research. It's also extremely important that data include demographic characteristics such as age, gender, and race and ethnicity. A key issue here is to identify and get ahead of any racial disparities. And if we don't have that information, we simply can't address those things effectively. Finally, the Commission recommended improving communication and increasing transparency concerning public health emergencies. One thing we heard in testimony again and again was that a lack of communication really hampered the responses to this crisis. And so this is a central recommendation in response to that finding. In order to do that, we need to invest in clear and reliable channels. So now we'll move to the discussion that will be moderated by, as you heard, Germán Lopez, who's a senior correspondent for Vox, where he covers criminal justice and public health issues. Germán, I'll let you take it from here. Thank you.
Great. So I wanted to start with Dr. Inglesby. I think the first thing that is on a lot of our minds today is the COVID vaccine. It's in the news. And one of the major topics of discussion is who's going to get it first. So given that, I know that one of the Commission's recommendations is that people in prison and jail should be get a priority. Why is that? Why should people in prisons and jails have priority?
Thanks, Ramon. Just kind of starting with some of the basics. I think first thing to know is that I think is widely known that many of the U.S. correctional facilities are way beyond the capacity they were designed to house in terms of numbers of people there. So it's also really clear that the density of those facilities and the conditions of people who are incarcerated put them at very high risk of COVID transmission. In many of those facilities, it is difficult or not possible for people to physically distance. Isolation and quarantine may not be easy to put in place or make effective. We also know that incarcerated people have higher rates of underlying conditions. That's well documented. And those conditions put them at higher risk of severe outcomes of COVID should they get COVID. We know that more than 10% of people who are incarcerated in federal prisons are over age 55. So that puts them at a higher risk than certainly than the people who are younger than them. That's a clear age relationship in terms of severity of illness. Many facilities have poor indoor ventilation. We know that people breathing in the same air, poorly ventilated air, are at high risk of transmission. And that you put all those conditions together and you have the perfect conditions for super spreading events. And so it shouldn't be a surprise to us then that more than 40 of the largest outbreaks of COVID in the United States have been in correctional facilities. And we have seen outbreaks of more than 1,000 or 2,000 or 3,000 people in a single facility with COVID, which should be completely unacceptable to all of us. And as we heard earlier, overall in the country, we've had hundreds of thousands of people sick and 1,800 people die. And the Supreme Court has said that the state assumes responsibility for the safety and well-being of those it incarcerates. And I think that this clearly includes the case of the pandemic we're now experiencing. The CDC has said that people that one of its priorities is to save the lives of those at highest risk. And it's clear that people who are incarcerated are at high risk. So I think the view of the commission then follows all of that, which is that people who are incarcerated should receive a higher priority in the country than those who are at less risk than they are.
Ms. Nelson, I wanted to turn to you because, as Dr. Inglesby mentioned, one of the problems here is population density in jails and prisons. The commission recommended a safety valve, and I'm sure you have experience with this in your county, but could you walk us through what places should be doing here in terms of working on that population density problem?
I was muted. Yes, the commission has made recommendations about how to reduce density in incarcerative settings in a safe manner. And they've laid out the various intercept points throughout the system and described strategies that can be employed at each of those intercept points to reduce density in both jail and prison populations. So the safety valve mechanism that you speak about is essentially an emergency release mechanism for medically vulnerable inmates. The commission has recommended that local, state, and federal governments establish protocols which would allow medically vulnerable inmates incarcerated in prisons to petition for early release. And they've suggested that this responsibility and authority lie in the executive branch, so that the executive branch can also consider the interests of victims and survivors as appropriate. But in addition to prisons, the commission also considered intercepts for local jails and considered alternatives to entry, not hearkening the threshold, the back door of the jail, and considered alternatives after entry. And those include using citation in lieu of arrest. So for law enforcement, the recommendation that law enforcement consider where appropriate the use of citation instead of arrest, so that someone is not even brought into the back door of the jail. For the courts, the recommendation that technical violations of probation be considered through a notice to appear as opposed to a warrant for arrest. And the commission has also made recommendations for alternatives after entry to the back door of the jail. And those consider diversion opportunities for those people who clearly are suffering from mental health issues or have substance use disorders, and expanding those opportunities. Those recommendations are laid out in yesterday's report.
Pastor McBride, it's kind of building on some of what she just said there, is that, like, look, there's this, I think, old question of whether people with substance use disorders and mental health disorders should be in jails or prisons to begin with, or if they should be getting treatment. I'm just curious, what's your thinking on this? How does this relate to COVID, and how do you like essentially combine these two issues?
Well, certainly we know that the issues that have been exposed to the country, particularly related to Black and Brown communities that are most vulnerable in our society, our Native American communities, et cetera, it helps us to appreciate that not only are there underlying health conditions that predate COVID, but there are also underlying social conditions. And our systems have not yet reoriented itself to treat vulnerable populations with compassion and with care versus punitiveness. And so one of our most important recommendations, I believe, where we came to consensus, is the need to create a massive public health sensibility within the criminal justice system as it relates to the large swaths of our community members who are indeed suffering from historical and intergenerational trauma, and often are medicating themselves through substances that likely then turn into addictions. That we must figure out ways to see trauma as something to be healed and not punished, as something to be supported and not criminalized, particularly within vulnerable communities of color. And even when we go deeper into those who are currently incarcerated and as they prepare to return to our communities, we must highlight that homelessness within our communities all across the country are disproportionately represented by Black Americans, by Latino Americans. 30% of the US population is Black, but 40% of the homeless population is Black, which means to remind us that even as we engage with folks in the system, those coming home, that where we start in our assumptions will greatly determine the approaches that we take. And in the recommendations, I think we have tried to reset the conversation of not just COVID-19, but also the criminal justice system to approach a public health approach, particularly to those individuals in our communities who are indeed struggling with intergenerational trauma that manifests itself in all kinds of behaviors that include substance abuse and the like.
Dr. Inglesby, I don't think I'm breaking news here by acknowledging that the federal government hasn't exactly done a very great job with COVID, and that it's dropped the ball on a lot of things. But it seems really telling on this issue. I don't think we've really gotten much, if any, federal guidance on what should be done in prisons and jail settings about this kind of stuff. It just seems like it's a patchwork of states doing different things, different cities, counties doing different things. So what should we do about that? How do we avoid it, not just for this current pandemic, but the next one too?
Yeah, well, I think it's so true that it really is this patchwork of expectations and standards around the country. Some are doing better, some are not doing well at all. And so we learned how variable the data is around key measures that we would expect to see in normal reporting about COVID in most other, or if all other settings. So, for example, in the criminal justice system, we see that for most places, we don't see how often people are tested. Are they tested at all? Are they tested when they're transferred into a facility, when they leave a facility? What are the results of those tests? There's basically no visibility on what's happening and no way to compare it, no way to look for best practices. So it becomes just kind of 1,000 different examples here and there and across the country. And if you compare that to, for example, the kind of a standard of excellence that's emerging around tracking COVID in universities, obviously different institutions, but also large, complicated institutions. And they, over the last few months, have really kind of created this standard of excellence where every day they show how many people are tested, how many people are positive, how many people are negative. They're pretty clear about what the physical distancing measures are, their practices are. There's no reason why we can't have the same information be the standard, the expectation in correctional facilities and really across the criminal justice system and all of the major elements of it. How are practices being put into place? What are we finding? What's getting better? What are we learning? And this kind of transparency in the university setting has really pushed universities to have stronger practices, stronger physical distancing, masking requirements, and to let families and the students and the employees in those settings really understand what their risks are and try to control them. And it just seems like something that the commission felt very strongly that we should be trying really to set standards of excellence around data and transparency across the system. So we're really hoping that will be something that happens in the near future.
Yeah, Ms. Nelson, I mean, on that data and transparency front, I'm sure this is something you've dealt with yourself, but one thing I'm always struck by as a reporter is how bad data can be in the criminal justice system. I mean, it usually has a lag, but also just like the use of outdated technology. I'm sure that contributes to this data gathering efforts. So I'm curious, what are some of the problems here in terms of like data collection, technology? What can we do to solve those kinds of problems?
Well, I would like to just address something that Dr. Inglesby just mentioned about how institutions are functioning really in silos across the country. I spoke to the director of our local jail yesterday morning, and she's done and her staff have done a really extraordinary job with making sure that they have been as expeditious as they have to employ state-of-the-art technology as quickly as they can. And she is collaborating with her colleagues throughout the United States, but it's conference calls or webinars where they're learning from one another. And there hasn't yet been best practices for correctional institutions, which would absolutely include tracking data. So when at our office, we collaborated with all of the criminal justice stakeholders locally, including our jail, early on in an attempt to use the tools available to us to reduce density, recognizing the issues that we've talked about today, that the spread of COVID in a jail facility. And one of the things that we wanted to do as an office was track those people who were subject to an initiative employed by our office called Expedited Review. And we wanted to track what happened to them, how quickly they were released from the local jail, but then what happened to them afterward. And we just didn't have the infrastructure to do that. That would be important if we're looking backwards. Hopefully we're on the horizon of a light at the end of the tunnel. And if we want to look back at things that worked, what was successful and perhaps what was not, that data, that ability to look retrospectively would be important to all of us. And we just didn't have the infrastructure to do it. And I talked to colleagues across the United States who also lack that infrastructure. So one of the things that we've discussed as a commission and think is important is both one, the collection and reporting of data, and the communication. You've heard that over and again. So if the jail has cases and knows about cases, the courts need to know about that. And so does the public defender's office, and so does the prosecutor's office that interact with those people. And we should be tracking data, if for no other reason, that we can look back retrospectively to determine what was successful, what we should employ going forward, and perhaps what we should tweak.
Pastor McBride, we've been talking a lot about the role of government here, but as I'm sure you're very obviously familiar with, is the role of non-governmental organizations here matters too. What do you think these groups can be doing in like these kinds of circumstances with the pandemic and the population density, like all the issues that we've talked about today? What do you think are some of the important things they can be doing here?
Well, it's important to appreciate the groups. Many of them are already doing it. Many of us are in the community. We're responding on the front lines without being deemed essential workers. Many of us are having to supply our own PPE. Many of us are actually raising dollars and resources in real time to get PPE into jails and into some of our most vulnerable neighborhoods and communities. And so the question is not what should community organizations be doing? The question is, how can the systems of our government link up with the already existing web of interlocking networks that have an intersectional approach in their DNA? Sometimes we are expecting or asking government to remake itself on the fly in ways that many of our community organizations have already had to create a certain sensibility in order just to remain relevant and effective. And so we talked about in our commission, what does it mean for us to actually link in with HBCUs who have public health agencies already built in, or other public health public health schools of existing universities in many of our cities, knowing that within these public health institutions, both in HBCUs or predominantly white institutions, we know that there are public health interdisciplinary experts that have an intersectional approach, prayerfully, that will allow us to not have to start from scratch. What does it mean for us? To prioritize organizations that are Black-led, Brown-led, Native-led, women-led, in these kind of rapid response moments during these kind of crises. We know we have to create the kind of liaisons. If this administration has taught us anything, messengers matter. And so if we don't have the right liaisons to help message and explain some of these not only immediate risks, but the mitigation factors, then we will find ourselves trying to build a boat while it is literally raining. And so we must then identify these kinds of best practices. This is mentioned in our report as well. Identify the best practices and then prioritize those best practices as we are attempting to respond to the pandemics or the emergencies as they arise. We think institutions have to be willing to sit and learn and wrestle with systemic racism and issues of bias that are built into the kind of DNA of many of our pre-existing systems, but that does not need to paralyze us. We have the expertise often already in our community-based organizations or non-governmental institutions. It's really important for us to just build this web of interlocking, intersecting, collaborative partnerships that allow community members to come to the table and not just talk, but also help implement and solve problems in real time. I think then we can actually save more lives and actually build the kind of infrastructure needed for the sustainability of this work.
I wanted to put one last question to all the panelists. So the commission recommends that leaders be bold, recognize the humanity of the people in the system, build equity, trust, and confidence. I wanted to get a sense essentially of how each of you think of these principles, how you would apply them in the jails and prison settings, the criminal justice system setting. I'll start with Dr. Inglesby. How do you personally apply these principles, or how do you view these principles?
Well, thanks, Ramon. Well, just going through them, I think they're pretty clear and powerful. I think just starting with bold, when we see the criminal justice system has not worked to protect people from this pandemic, I think it's really important for us all to step back and think about how the system protects people from other challenges. For example, the pandemic has exposed how much the criminal justice system has had to carry the burden of public health problems in society and how difficult that is, particularly the ones Pastor Mike mentioned, public health problems around mental health and substance abuse. And so the commission, and I think personally that we should be looking to make systems change, not just putting Band-Aids on the system and hoping we can hobble through the pandemic, but we should be thinking about what would fix the problems that we see. In terms of humanity, I think one of the things that we talked about in the commission was we should imagine what it would be like if one of your relatives were living in a correctional facility during this pandemic. How would you want them to be treated and cared for when they face this risk of COVID within their institution? And that was a principle that we talked about and I think is really important. On innovation, I mean, we've already talked about this now. We're not using the tools that are available to institutions, to other systems to get better at this, to track data, to communicate, to be transparent, to put public health practices in place. So we should be empowering and asking our correctional facilities to be able to use those tools that we have and we routinely use across society. And finally, in terms of equity, trust, confidence, we see that people incarcerated by the criminal justice system in the United States are disproportionately people of color. And so we need to recognize that reality and in the setting of this pandemic and feel responsibility how to change and address that. And the pandemic has taken full advantage of the inequities in America. And we see that by the number of people of color who are sick and the severity of COVID in that community. And so, basically to summarize, we need to take that as a very, very serious underlying motivation for change, and to build trust and confidence in the communities of people that are disproportionately affected, and recognize the role of this commission and those working in the system to try and change that.
Ms. Nelson, same question to you. How do you build on these commission's principles, like the principles stated by the commission? How do you think they should be applied to the criminal justice system? How do you see it in your own work?
Well, I certainly echo everything Tom just said, and the commission spent a lot of time talking about these themes. One thing we talked about in the concept of humanity, and we talked about this a lot, was the reality of how interconnected we in fact all are, and how the public, this challenge, unbelievable challenge for public health, has really caught the criminal justice system certainly by surprise and unprepared. And so in terms of humanity, I think it's a matter of all system actors recognizing the dignity of all the humans involved, including incarcerated humans, and recognizing how we are interconnected, because our correctional staff who take care and have custody of incarcerated individuals are also our fellow man as well. And so we've really tried to, at least in our office, try to really expose that theme that we are in this together. In terms of being bold, look, I'm a prosecutor. I lead a prosecutor's office. So being bold to me really resonated when we were talking, because we're talking about stepping out of our traditional roles and our traditional lanes, which I will tell you is often something I don't do, in order to make sure that we are collaborating in a way that is important for the public health. So I will tell you my view of my own role, not just as being a law enforcement official or a chief prosecutor, expanded. It really is being a public servant. And if I take that to heart, being bold means I care for the public health of the people I serve. Certainly we need to do that in a way that maintains and recognizes public safety. And so we've, as a commission, really been deliberate and thoughtful about the recommendations we've made, so that we aren't recommending that things be done in broad brush strokes, but in a thoughtful way. But that's what being bold to be means. And I will say that building equity, trust, and confidence, this again comes back to, in my mind, obviously the collection and reporting of data, what we're doing, all of us, and collaborating and communicating with one another. Obviously, everybody has been catching up to speed, but I can think of just local examples of where information wasn't shared, and it breeds mistrust even among the entities and the groups of people who are supposed to be working together. So that can only be exaggerated when you're talking about outward facing with the public as well. So making sure that we continue to collect data, report data, and communicate with one another and with the public about what's going on internally in the system, I think is really important.
Pastor McBride, what about you? How do you apply the commission's principles? How do you think they should be applied?
Well, I'm proud to be, I'm probably the most radical of the commissioners. And so, this for me is, it is the baseline, meaning it is the bottom floor of what my imagination is as it relates to what we can and must do. I am someone who believes that the expansiveness of our imagination, coupled with the depth of our love for the people, particularly those directly impacted, allows us the ability and the flexibility to create the systems and responses that we need, particularly in emergency moments. Being bold to me is looking at all of these realities beyond the criminal justice system totally, like being able to acknowledge that when there was no COVID virus, there was still an issue of disproportionate contact with a criminal justice system within Black and Brown communities, not because Black and Brown communities are more criminal, but because the eyes of the system are disproportionately focused on our communities with a punitive lens. And so being bold means to not only acknowledge that, but coming out of COVID to take the opportunity as our whole country is now reorienting itself to a public health imagination to solving problems, to disproportionately now to apply that imagination to our most vulnerable communities. And I think the recommendations in this report give us a very baseline opportunity for folks who are dipping their foot in the water, so to speak, for the first time in a non-punitive response to the social ills of our communities. It gives you an opportunity to begin that journey, but please don't finish the journey with the recommendations in this report. It is a start. And I hope that as we continue to have not just the conversations, but build these kinds of networks, these interlocking networks of community-based organizations, public health agencies, some of our government actors and leaders, that we can begin to see humanity, not just in the frontline practitioners of COVID, but humanity in those who are indeed incarcerated or caught in the systems, or those who are coming home. No human being is disposable in this world, certainly in a pandemic. We should start with the most vulnerable. That is a bold idea. Start with the most impacted. That is a bold idea, and allow the resources of our hearts and our nation and our cities and our municipalities to build a beloved community. And I hope that radicality catches fire as we engage healing responses to the pandemic.
Well, I think with that, we'll go to questions. Just a reminder, if you have any questions, you can drop them in the Q&A at the bottom of your screen. But I think Abby's going to take it away from here.
Yes, that's right. Thanks so much, Herman. And thanks to everyone who submitted questions so far. Please go ahead and drop those questions in the Q&A box. We'll try to address as many as we can during our time today. Our first question is for Ms. Nelson. We've had questions in the Q&A about the various tactics that might be used in order to reduce density in the system. You have mentioned that you took specific actions in Jacksonville to help relieve the population, both inflow and the standing population within jails and prisons in your district. What measures did you take? And have we seen any negative public safety impacts of those new approaches you've taken?
So to the latter part of your question, we have not. Knock on wood, but I mentioned being deliberate and thoughtful earlier. Two things happened early on in our office that gave rise to thinking about this at the outset. I have a colleague, I work with a retired Navy admiral whose military career was spent in disaster planning and crisis intervention. And then I have a colleague, Dr. Wang at Yale, who contacted me about how dangerous incarcerative settings were. And so those two folks coming to me, this was not my concept. It had me thinking about what we can do. And so we started what we called an expedited review initiative, and it has several prongs. So, and our young prosecutors, we've really turned their world, I would say, upside down over the course of this, because we've challenged them to think much more broadly and to work much more quickly. So in Florida, we have, by rule, we have to make decisions for filing within a prescribed amount of time, 21 days. And we challenged our prosecutors to meet that time. And so when they knew a case that they would be rejecting and with an in-custody defendant, to do it earlier, not to wait to 21 days or to wait longer. We actually paired up our young lawyers with more senior lawyers who had more experience in decision-making and could assist and support that, that charge of being more efficient and more expeditious. We undertook a proactive review of all of our pending felony and misdemeanor dockets, which was a big undertaking and a continuing undertaking. And that was led by my colleague that I mentioned, with daily updates. That meant every lawyer had to look at their in-custody defendants and make a determination if they could resolve that case more quickly. We assigned eligibility criteria for those people who would be eligible for consideration for either expedited or early release or early review, and obviously carved out limitations that we felt were not appropriate for public safety. We considered pretrial detention, and we also worked with the jail. The last thing we did, we worked with the jail to identify people who were under sentence in our local jail and were within 30, we started at 30, 60, or 90 days at the conclusion of their sentence to make a determination whether they too would be eligible for early release. So really we attacked this at 4 different points. We communicated with our office. At one point we had a lot of success. We had at our low point reduced the jail population by close to 20%. We are back up again and over capacity at the jail and redoubling those same efforts. And then I would say too, in just this initiative, putting pen to paper, thinking through how we would go about doing it, and establishing a point person in our office to lead the effort has made a lot of a difference, I think, in the success of it.
Thank you so much for that detailed explanation, Melissa. So there's been an increase in violent crime this year, particularly homicide, and it has been both analyzed by our commission as well as reported broadly in the media. So many communities are facing this. Pastor McBride, what, in your opinion, accounts for that, and what can be done about it?
Man, it's such a great and important question. And I do think it's really important for us to use this moment and this season as a way to not only reflect on what we know works, but to challenge ourselves to recommit what works to scaling it up, even the more so in the pandemic. What we found all across the country very early on are that the emerging public health options related to reducing gun violence, some call it focused deterrence, others call it ceasefires, others call it credible messenger movements, outreach workers, hospital-based interventions. Many of these efforts found themselves paralyzed, if not totally inactivated or deactivated early on in the crisis, rightly so, because we did not know the length of the crisis. Many of our outreach workers weren't deemed essential workers in many of our cities, so they could not go out and continue to do the work needed to connect with those at the highest risk of shooting or being shot. Many of our credible messenger efforts were strained financially because of all kinds of issues related to local municipal budgets, et cetera. And so what we found were the pre-existing social conditions that drive violence in our communities: trauma, lack of opportunities, interpersonal conflicts, disproportionate contact with law enforcement. All of those pre-existing conditions did not go away. But what we call the medicine actually went away during the pandemic. And so we believe that it's really important to scale these efforts back up, to literally reimagine public safety, starting with the most violent and vulnerable among us. Reallocate, if you will, shift resources into these efforts as we come out of the crisis, rather than falling back to the knee-jerk reaction of a tough on crime, broken windows philosophy of policing that literally uses collective punishment on the whole community rather than the less than 1% of the individuals who are driving the violence. And so we do believe that the solutions that we have been working on for the last couple of decades, they have now come to be known as best practices. We need more mayors, we need more police chiefs, we need more public health folks to see the violence prevention community as experts in solving violent crime, not as the kind of second or third consulting agencies, and we leave all of that in the hands of our law enforcement agencies. And so even right now, many of us are launching a season of peace effort in a couple dozen cities across the country to bring our collective resources and assets and expertise together to love on, to focus on those at the highest risk of shooting or being shot, and give us some momentum heading into 2021. Plug in with us on the ground across the country, and I think we may be able to see not only a peaceful season, but hopefully recapture some of the magic and the glory that I think many of us have been able to experience around reducing violent crime in Black and brown communities for the last decade or so.
Thank you so much, Pastor Mike. So we've talked a lot today about incarcerated people, but police officers, correctional staff have also taken on just a large personal burden during the pandemic. So did the commission talk about staff, and were there specific recommendations that were made about frontline staff? Dr. Inglesby, perhaps you can speak a bit. There's certainly a tie-in here to how we're trying to protect medical professionals and first responders. So could you tell us a little bit more about the commission's discussion about these frontline individuals?
Yes, the commission did spend a lot of time talking about the work and the risks posed to frontline individuals in the criminal justice system, and thinking about the ways in which they should be protected, and they should have transparency in their systems as well. I mean, everyone who's in this system, we believe in the humanity of everybody who's in the system, both those who are on the enforcement side, those who are incarcerated, obviously the trial system, the community-based organizations, but for the people that are on the front lines and have as their duty kind of care for others, or who often are in fact acting as emergency responders in many places in the country. They maybe have a police function as part of their job, but also, being exposed to people who have COVID or might have COVID. It's really important that they have the right personal protective equipment and to protect themselves. And it's important to understand the impact of the disease in their own communities. They should have transparency around testing and about results, not obviously at the individual level, which we want to protect, but how well is a police force doing in protecting itself from COVID transmission? What's the data look like? That's all. We did talk about that, and we do think that's important.
Thank you so much, Dr. Inglesby. So many of us have talked about during both in our commission work and in today's discussion that the criminal justice system has historically been slow to make full use of all of the technologies available to it, either in data collection or otherwise. But we have seen agencies, particularly courts, adapt to the pandemic through technology. For example, things like arraignments held via Zoom, and even a move towards jury trials that, when possible, could take place online. Should those practices be here to stay? And are there any landmines that we should be watching for? Melissa, I know that this has been part of the discussion in Jacksonville. Could you tell us a little bit about your thoughts?
So yes, there are certainly things that I think we're going to see that will long stay as a result of the advent or necessity of using technology. Our office has a strategic plan with a goal of, at the end of next year, going paperless, and we had to do that within 60 days as we sent people home and figure out a way to work remotely, which meant working electronically. We are now, our court, not just first appearance court, but our daily dockets are through Zoom, and victims are appearing in sentencing hearings via Zoom and giving testimony. We've not attempted a jury trial via Zoom. We did attempt to bring jurors back for in-person, socially distanced trials, and we had to shut that down because of an incident with a COVID outbreak. So we are looking forward, hopefully, to next year and trying that again. I will tell you, our depositions right now that are being conducted via Zoom, I think that's probably a practice that will give people the option of continuing. For law enforcement, one of the positive, the upticks is that we've seen a appearance for deposition increase. And I think it's because they can do it at the convenience of wherever they are at the time that is time to give a deposition. I think for many victims, the technology can be a very good thing to be able to, from their home or their work, be able to watch a court hearing. I do think there have been some disadvantages to it as well. The criminal justice system, I think, works its best when we are in person. We're able to resolve cases. We're able to function, I think, even when we're in an adverse setting, much better when we're in person. And so that's definitely been a downside of all of us working remotely. But I certainly think that there are pieces of the technology we've had to employ that are here to stay.
I'm curious, going a little bit further in this technology question, if there are any equity or access issues that perhaps are being experienced in your community. Pastor Mike, have you heard anything about concerns about access to these new technological tools?
Well, I certainly believe that we must continue to look at the diversity supplier conversation when we have any of these conversations. Black tech in particular, I know for sure, is on the rise all across the country. One of the ways that we can help really accelerate the kind of economic return and stabilizing efforts in Black communities and other poor communities or under-resourced communities across the country is to hire and contract with Black, brown, women-led organizations who are doing and providing tech solutions. One such organization that I just ran into is called Figures Technology. They are a Black telecom organization in Florida that provide all kinds of resources for 5G phones, computers, etc. There are organizations like this all across the country in every one of our communities. And so rather than defaulting to some of the folks that we know may have some of these contracts locked down, what does it look like to open up some of these opportunities for diversity supply, and also really ensure that people are not being preyed upon or disproportionately discriminated against as they engage in some of these systems. I know our groups like Color of Change and others have been lifting up amazing campaigns to highlight things of like the way the telephone industry charges folks for phone calls, on and on and on and on. There are very, very easy, low-hanging fruit ways to make sure that we diversify the tech spaces. In the diversification of this piece around tech will actually solve more problems, will identify the kinds of solutions that emerge from those directly impacted by these said problems. So absolutely, I think it's a worthy conversation that we should keep pushing ourselves at every level to employ. I know I am, and we are, even in our CBO space, and I hope that our governmental partners will do the same.
Thank you so much. Well, this has been an incredible conversation. I'm so grateful to all of our panelists and also everyone who has submitted questions. Before we close, Herman, you had the opportunity to speak with all of our panelists today. Are there any closing thoughts or key takeaways that you're taking from this conversation?
Well, just personally, it's as a reporter, it's been nice to see like these reports come out and like have actual information about what's happening in the criminal justice system in regards to COVID. I mean, this year has been rough on, I think, all of us, but one thing that I think makes it more difficult is just that we have a complete lack of data for so many of these issues, and it's been up to like non-governmental agencies essentially to fill that gap. But yeah, I think the biggest thing for me is that this is an issue that needs to be taken seriously, and it's to be reported by the media, and I'll try to do that. I hope other journalists do as well.
Wonderful. Thank you so much. Well, thank you, Herman. Thank you to all of our panelists for today's conversation. Thank you to our commissioners for your service on our commission. This has been tireless work by all of you since July, so thank you for that. And thank you to everyone who's joined our conversation today. Our report is available at covid19.counciloncj.org. And we hope that you continue to remain healthy and safe through this season. Thank you so much for being here.